Hi guys, my name is Oriana. I'm a pelvic health physical therapist assistant here at Rehab United, and I also have Alyssa in the back, who is my partner in crime. We both treat in pelvic health. She's a DPT at our company. We're going to be going over the power of movement in that perinatal journey, and you heard her talk about pelvic floor exercises, so we're going to dive into what that means and how we can allow your pelvic floor to be ready to try to conceive, and also during that prenatal postpartum period. So that's just kind of what we'll be talking about. So let's go over some little fun facts. Exercising, which is not just Kegels, exercising can actually decrease your chances of incontinence during pregnancy and after you have the baby. It can also decrease or shorten the first stage of labor and decrease your C-section risk, as well as decrease gestational diabetes. So these are all things that women, when they're trying to conceive and then they are in that perinatal period, they're trying to avoid. So we definitely want to encourage that once you're there. But my two favorite little fun facts at the bottom is that there's no link between exercise and miscarriage. And so if you are trying to conceive, you can still exercise, and that's okay. It's actually really good because it actually increases implantation rate in live births. So exercise increases that blood flow to that uterus. It just increases blood flow to this whole area. And exercise also relaxes that pelvic floor. That way you can tolerate intimacy better. So it's actually a good thing. So you want to encourage that movement during all parts of your journey. So she already touched a little bit on how the pelvic floor works. We have our little model here where it is a set of little pelvic floor muscles. We have different layers and it goes all the way deep inside, and it just supports the organs. The pelvic floor muscles should lengthen and they should contract. They should be able to tolerate different types of pressure. They should be able to just smooth out whenever you need them to smooth out, like when you're having a bowel movement or when you're having a baby. But they should also tighten whenever you have to go to the bathroom and you're not near one, or whenever you are laughing, coughing, sneezing. So those are all really important. The diaphragm connects to the pelvic floor. So the diaphragm works alongside it. And if you don't know, the diaphragm is that muscle that sits underneath your rib cage, and it goes all the way around. So when you inhale, that goes down. The pelvic floor should also go down. When you exhale, everything comes back up. So inhale down, exhale back up, which is why breathing is so important for that pelvic floor and for that pelvic floor relaxation. And she talked about pelvic floor exercise and pelvic floor relaxation, but we will often see that if somebody doesn't have the stability that they need around the pelvis and other parts of their musculature, then their pelvic floor can actually get pretty tight too. So we want a well-rounded body, basically. We want well-rounded glutes, well-rounded inner thighs, abdomen, even like what happens whenever you're balancing. All of that will actually help your pelvic floor be strong, but not too tight and not too weak, okay? Other thing is that nervous system connection, which she did just touch on. We definitely want the pelvic floor to relax, and we can do that with nervous system relaxation. If we are a little bit stressed out, our pelvic floor will tense up. So if you are in that trying to conceive period and you're a little bit stressed out about possible pain happening, you may be tensing up your pelvic floor and may not be able to tolerate penetration. So working on that nervous system relaxation is really important because it literally relaxes the pelvic floor. And we do that with down regulation techniques. So she already touched base on some of them, but I have a whole list here. Diaphragmatic breathing, meditation, mindfulness. So that's just being like, okay, I feel my feet on the ground. I feel like the cold AC, being mindful like that. Journaling, like she said, mental health therapy, good sleep, which I know a lot of people struggle with, but trying to get that good sleep, trying to eat a healthy diet, exercise, moments of fun unrelated to work or chores, even if that's you like singing a fun song or laughing, listening to like a comedy skit on your phone while you're cooking dinner, something like that. Just trying to have a little bit more downtime in your day where it does lift you up. That can actually help to reduce that pelvic tension. So why is pelvic floor health important for fertility? She already kind of touched base on it, but if you can tolerate that deep penetration, then you're going to have more mucus production, and that can actually help out with sperm motility. And also, if you are just having that pelvic floor health and that pelvic floor relaxation, then that will help you tolerate those interventions that you need during the fertility treatments. And then if you do happen to deal with that ovulation pain or that pelvic cramping during that luteal phase of your cycle, if you have that increased constipation because you're taking progesterone supplements, things like that, having good pelvic floor health so that way you can relax the pelvic floor to eliminate your bowels or be able to just breathe into the back of your pelvic floor so that way you can tolerate these different treatments. All of those will help you out. Why is pelvic floor health important in pregnancy, or more so, how does it help pregnancy? Well, it improves joint stability. So when you will get pregnant, your body does change and alter, and your joints do move a lot more, and that's normal, that's great, but it does move your gravity a little bit more forward. So we have to learn how to adapt to that. Also, whenever you are pregnant, that changes the way that your body tolerates pressure in the abdomen. We call that the intra-abdominal pressure in this cavity right here. Whenever you take a deep breath in, that pressure fills up, and then whenever you exhale, that pressure releases. Whenever you have more stuff here, that intra-abdominal pressure decreases. So we need to make sure that we can move our body in certain ways to get that, so that way we don't have prolapse, diastasis, incontinence, things like that. Also, if you exercise and have that pelvic floor health during pregnancy, it can help out with your endurance during labor, because labor can be long. So you want that. It can help out with the pushing mechanics during delivery, so we can teach different things of what to do with your bones, making sure that your bones can manipulate or move in certain ways so a baby can actually get through that birth canal a little bit better. And then you also have faster postpartum recovery. Think about how we'll do prehab when somebody's about to get shoulder surgery or hip surgery. If you work on your pelvic floor health and work on exercise during pregnancy, you're likely going to do really well after you have the baby. So we're going to go over the different types of movements that you could do during each stage, and then we're actually going to do them together. Okay, then you can get up and moving. So first thing is, when you're trying to conceive, we're trying to release the back of that pelvic floor, because the back of the pelvic floor is usually what gets really, really tight when people are dealing with that ovulation pain or just that pain with intimacy. So we want to release that. We want to work on that down regulation, so that way your body can again tolerate something going inside. And then improve your tolerance to intimacy by doing different stretches on your side, on your back, just kind of movements that you would do when you're trying to be intimate with your partner. And then I put little examples here. So laying on your side, all fours, doing stretches there. You can even stretch out the abdomen, which will help out the front of your abdomen, like will help out any pain that you get in that cramping. And then whenever we want to stretch out the back of that pelvic floor, we want to do a lot of hinging motions like this. We also want to do a lot of twisting motions. So if I have one foot here, we want to twist that, because the muscle that gets really tight, it's called the obturator internus, and it gets tight when we stand with our toes out, which you may notice if you stand a lot when you're doing dishes or something, it's often toes out. So we actually want to decrease that with hip internal rotation instead. So you're going to see that continue to come up. Then let's say you get pregnant, you're in that first trimester. What we're doing is just trying to allow your body to get ready for everything to grow. Okay, so when women get pregnant, they usually get here, and we want to try to decrease how much that happens. So we want to open up the back of the rib cage, because a lot of women lose that during pregnancy. We want to work on that glute and core stability to try and decrease how much that's going to change. And we want to work on your intra-abdominal pressure management. So we're going to do this with things like breathing into the back and sides of your ribs. So you'll inhale through this back space. We could do little like squat walks where you're going against resistance, and you can also do planking. And then also, this is really important, is that pressure management, you want to exhale with everything that's hard that you do. So if you have to pick up something heavy like groceries, you exhale while you do it. If you are getting off the couch and your couch is really reclined, you exhale while you do it. You exhale with anything hard that you are going to do. Then let's say you get into that second trimester, things really do start to change here. So we're going to modify for those changes. Again, we want to maintain that hip internal rotation, because this is when women really start to lose that. Continuing with that glute and core stability, and working on postural endurance, because things are getting heavier. There's more body weight going on, and there's literally something that's growing. So it's changing. So we want to work on good alignment and doing things in a standing position, so that way your body can get that endurance for your everyday activities. So what you'll see here for pelvic floor strength today is not necessarily laying on your back and breathing and stretching. We're actually going to be doing some exercises to make it so that way you can tolerate that when that comes. You can also do, it's really important to note that if you want to do core work, you can do elevated planks. Planking on the floor after like that end of second trimester is not ideal, right? But you can still do a planking just in an elevated position. And you can still do twisting, just not deep twisting. I think it's a common misconception. We give twisting to our patients all the time when they're pregnant. You just don't want to do those crazy, super like yoga binds, basically. Whenever it comes to that hip internal rotation, again, you can do like little split stance motions like that. Again, those little banded squat walks, which you guys are going to do today. If you want to do some core work, you can hold a weight in one side and march, because anytime you lift up your leg or your arm with some load, that's getting your core. So you're still getting core exercise even though you're pregnant. You can even do something like chop like this. That's going to get your core. And then for postural endurance, you could like push something into the ground and you'll feel your core activate, things like that. For that third trimester, what's really cool is that testosterone is high, so you can maximize those muscle gains. And we want to utilize that a lot, because after you have the baby, those first 2 weeks, we want you to rest. So you kind of want to build up those muscle gains ahead of time. You do want to manipulate your body to be able to tolerate pushing. So whenever we are pushing baby out, when that does happen, you want your knees to go in, because if your knees go in, it opens up the back of that pelvic floor, if you can see that. And that's where baby's going to stretch to come out. A lot of people will move this way instead, but that closes the back of the pelvic floor. So we want to do things that are going to pull you through this motion instead, and that's going to be that hip internal rotation that I keep mentioning. We get that by strengthening out the hamstrings, and then we also need this little sacrum right here, this bone right here. We need it to kind of move out of the way for baby to get out. And so there's a huge muscle, the lat muscle, that goes down and attaches there. And when we do pulling motions, it actually helps to open up that space. Whenever you do give birth, you pull your knees in, and that pulling motion is going to help to increase that as well. Also, whenever you give birth, we want you to exhale while giving birth. We don't want you to hold your breath, even if they may cue that otherwise. It always depends, so always listen to your doctor. But we do cue exhales. So if you work on that exhale now and that core strength now with that exhale, it's going to help you whenever you're literally pushing baby out. So be like that. And then the last thing I'll say for the goals is the diastasis recti, which is that abdominal separation, 100% normal in every single late end of term pregnancy. We want that to happen. We just want to decrease how much that happens. And so we do things like twisting motions, trying to exhale while you're doing that. So like I said, when we're trying to increase that testosterone, you can go ahead and exercise at higher reps, higher load. And then you can also just get your heart rate up to zone 2, zone 3, that 70 to 75%. When it comes to that hamstring and lat strength, you could do RDLs, you could do little pull downs, which is something that we're gonna do today. You could, again, can do that little split stance row that I keep mentioning right there. You can even, if you can't reach that, you can even have your legs like this and just twist towards the end of pregnancy like that. You are going to be pulling your legs at the end whenever you're pushing, so you can pull your legs like this. So we'll do a little pull like that. And then the Pallof press with rotation and pressing down sideways, that's just basically trying to get your core to come together. So it could be something like pushing a stick into the wall and feeling your core, or it could be something like pulling something that's resistance this way and then you feel your core. All right, the last one is movements for postpartum. Those first 2 weeks, we really do want you guys to relax and rest. And we want to reestablish that diaphragm and pelvic floor connection. So you can do that with long pursed lip exhales, nice long deep breaths into your back, exhale out through your mouth, and feeling that pelvic floor connection as you do that. We also want to maintain that rib cage and chest mobility, because when you do have that baby, you are going to be here a lot and you no longer have the uterus to support you. So you may feel kind of tired in your upper back. So we want to open that up. We do a little pec stretch or moving the torso in all directions. And then continuing to manage that pressure, exhaling with everything hard that you do. And the number one tip we give every single person is to log roll. So don't just get out of bed. You roll to your side and push yourself up as you exhale that whole time. So that way we're not increasing any pelvic floor issue, okay? Those are our sources, and that is it.